The broadcast is now starting. All attendees are in listen-only mode.
Good morning and good afternoon. Hello, I'm Joshua Hudson with the National Native Network at the Intertribal Council of Michigan. Welcome to today's webinar that's hosted by the National Native Network, and we've partnered with the Americans for Nonsmokers Rights Foundation, the Black Hills Center for American Indian Health, and the Southwest Navajo Tobacco Education Prevention Project to present strategies to reopen tribal casinos 100% smoke-free. There will be no CEUs offered for this webinar. We encourage questions and comments, so if you look at the screen, you will be able to, there's a screenshot of the GoToWebinar panel. So please feel free to enter questions for the presenters, and if you have a specific question for a specific presenter, please note who they are when you're seeking an answer. And this is the script at the bottom of the screen says, this mural was created from community members and stories on their vision on what health and traditional tobacco looks like in their communities. We worked with artists Mario Henriquez and Greg Dio. This mural is at the Minneapolis American Indian Center. This project was funded and supported by Clearway, Minnesota in collaboration with the Native Youth Alliance of Minnesota and community members. Opening today's webinar is El Yazi. El is with the Southwest Navajo Tobacco Education Prevention Project. Over the past few years, he's worked closely with the Navajo Nation, including distinct spiritual groups on the vast Navajo Nation.
Yate, welcome. We're happy that you're all on the webinar with us, relatives from all four directions. I'm going to say a short prayer and humbly speak to our great spirit and ask for guidance, and that our great tobacco, our spiritual tobacco, is given respect again throughout the nation, so that we could only use that for prayer. So I'm going to proceed with my prayer right now. Adon da epe sohotezend eben yedolil. Nana adon da in rego adoben yao chata inigin rekit hao kin bio. E adot adolil nitzend ashon de digin yod e digin jobai. Nika dilwot. Hon dat abetse is klezit ada da hekut ah jobai nitzend. Ni Washington has ajhut ah. Nakabet ya hat dilne bin sa kese de dolil. Adon nil what I now is kandolil. Wajodolil. Wajana. That's the end of my prayer. I'm ending with a blessing way wording. Thank you.
Thank you, Al, for your prayer and words in the Navajo language. Clinton Isham is our next guest. Clinton is a health consultant and works closely with tribal communities throughout the country.
Hello, everybody. My name is Clinton Isham. I'm enrolled citizen from Lac du Flambeau, which is a Ojibwe reservation in northern Wisconsin. I'm an independent consultant currently working with American Non-Smokers Rights Foundation. Just a little bit of background about this webinar and how it came to be. With the support of American Non-Smokers Rights Foundation, I've been helping create some mini videos that are intended to show the benefits of tribal casinos reopening smoke-free. When we finished our first video, which we'll show on this webinar later on, we had a conversation with some tobacco advocates, tribal tobacco advocates around the U.S., and we talked about the need to disseminate these resources to tribal leaders, to elected tribal leaders, and also gaming leaders and decision makers. And so our idea was to have a webinar where we can discuss strategies for dissemination. So the questions that we were hoping to discuss and have action items around today are like how, what are the best ways to communicate with your tribal leader? What is the best way to communicate with your gaming decision makers and your respective tribal casinos in your area? And so we're going to have a number of speakers that will help discuss kind of action items and very concrete steps on how to do those types of things. But I think the last thing that I wanted to mention is that I know there is an urgency for finding steps to best protect the health for tribal people in the wake of COVID-19. And we have throughout our history a lot of different pivotal moments in time that that there's these things of sense of urgency in tribal communities. A couple of years ago, there was a huge movement, the No DAPL movement in North Dakota. So the list goes on. And I think the real purpose of this call too is just to energize people and have you leave with this sense of urgency that we must communicate this with our tribal leaders, these resources that we're going to share with you guys in your own voice, that we need to reopen these tribal casinos smoke-free, not only for the health of our tribal people, but we know that there are many benefits financially as well, and that our tribal casinos could earn more money, and that means more money into tribal programming, and that programming that goes to education and health and so many things. And so we're here to support tribal casinos. That is our goal. We want to support tribal casinos reopening, and we want them to earn as much or even more revenue than they were when they were closed. And so I think if we were to leave with anything, I think that is the point of urgency I would like everybody to leave with is reach out with these resources, communicate with your tribal leaders, and we're going to talk about steps on how to do that, and then also have a discussion with all the attendees to kind of present your own ideas and share your ideas, and also an opportunity to ask the different attendees questions that you have. So thank you to all the attendees. Thank you to the organizers of this webinar, and miigwech.
Miigwech, and thank you, Clinton. As always, we're happy to have you as part of our forum. Our next guest is with the Ho-Chunk Nation of Wisconsin. She's the Municipal Relations Coordinator with the Ho-Chunk Gaming Madison. The Ho-Chunk Nation owns and operates 3 Class 3 primary gaming facilities and 2 Class 3 ancillary casinos. Ho-Chunk Gaming Madison is their only dedicated Class 2 gaming enterprise. In simple terms, Class 2 gaming is players playing against one another, as in bingo. Class 3 is a patron playing against the house, as in blackjack. Missy, thank you for being with us today. Tell us about Ho-Chunk, a tribal nation, and their decision in going smoke-free in their tribal casino at Madison. My understanding is that it was based on a survey?
Hello, yes. First, I just want to say hello and thank all of the participants for joining in on this webinar. And I am not only honored, but delighted to be here to speak to the experience of going smoke-free. So in November of 2014, we surveyed our guests, and that began because we had heard rumblings from our guests about the smoke-filled environment. So our executive manager, Daniel Brown, put out a survey to find out, just to take the temperature of our clientele. And what we found out was very surprising. It was exactly the opposite of what we thought we were going to see. The results indicated that it was a prime time to transition to a smoke-free environment. Although there wasn't a crisis going on, it was a wonderful opportunity, as I believe the one that we are currently in now. But what we found out was that 70% of our clientele was in favor of us going smoke-free. What we thought would been the reverse, that 30% would support this initiative and that 70% would be would not be in support. But we were pleasantly surprised. So our process was our executive manager, Dan Brown, met with our tribal leadership of our tribal government, our president, our legislature, and our executive director of business to engage their support in what we wanted to do at Ho-Chunk Gaming Madison. Once he had their full support, he met with our casino management team, which I forgot to mention, they were also part of this, encouraging this process going forward. So once he had the support of the tribal government, he then came back to our casino management team for a careful and in-depth discussion on how to implement this. And that was, as I said, the survey was done in November of 2014. So in June of 2015, we notified our guests of the upcoming change. And on August the 1st of 2015, we went smoke-free.
Wow, okay. Thank you, Missy. So the argument by many tribal casinos is that making casinos smoke-free will grossly reduce their earning power. Casinos will lose revenue, patrons, and have less business. And so that may have happened at Ho-Chunk Madison, but could you explain just a little bit more about that?
Sure. So initially, for the first 90 days, we took a dip. But we stayed the course. Anytime you're going to implement something of this magnitude, you really need to stay the course. And lo and behold, by the 15th month, we exceeded our revenue of the previous year. And surprisingly, our head count went down, but our coin in was up. And I am so proud to say we now lead our nation out of all of our facilities in net revenue generation. In fact, things went so well with our smoke-free effort that last November the 4th, we went vape-free as well. And just, if I could just really quickly mention some financial benefits to consider, which we realized were providing a smoke-free environment, especially now. I'm sure that casinos all over the country are they're trying to sanitize and disinfect their facilities. And, you know, going smoke-free, that helps to maximize that investment. And I'm sure for all of us right now, every dollar, every penny counts. So that's one way of maximizing that investment. And it also provides a smoke-free environment, attracts a different type of non-smoking clientele. You know, presumably they might have more disposable income as they're not spending their money on tobacco, commercial tobacco products. So just that kind of speaks to why we saw a reduction in our head count, but the type of clientele that we attracted by providing that smoke-free environment. And we also realized a cost savings on our air filtration system because it lessened the frequency of changing the air filters on our HVA systems. Also, our gaming floor staff, there were not many needed to be put out on the floor because there were no ashtrays to clean or no tar and nicotine residue to remove. And also providing a healthy smoke-free environment, it minimizes illnesses and thus doctor visits where reducing the health insurance costs and also absenteeism of your staff, not having to reschedule and move people around. And my last point that I'll make is that we do offer a outdoor, totally separate, climate-controlled smoking hut, which is detached from the casino building. It's not attached to the dwelling structure at all. And it wasn't that expensive to implement. And it turns out it's not a major inconvenience for guests to go outside and utilize that facility. And, you know, we were able to do it for pretty inexpensive costs, because we constructed, our maintenance folks built that structure for us. But yes, so a lot of things to consider when looking at the financial reasons to do this.
Okay, thank you, Missy. I did have one more follow-up question that I wanted to ask. So I live in my tribal community, and I know that we have a fair amount of elders who smoke. And so how have the elders in your community taken this move?
They are very happy with that, because we are able to provide them a smoke-free, clean, healthy environment to enjoy their recreational activities. And many of them do enjoy coming out to the casino and playing and socializing with other tribal members, our tribal members on staff. So they were really supportive of this. And, you know, especially for the elders, they can stay in the casino much longer than if they were in a smoke-filled environment. It's much easier on their health, their heart, their lungs. So it just is pleasant for everyone all the way around. And I think that folks will find that even smokers will agree that that's a much more pleasant environment to enjoy playing and gaming and socializing.
Okay, thank you, Missy, for being with us today. Please give our regards to the workers at Ho-Chunk Madison who are leading the nation with their smoke-free tribal casino.
Thank you.
Our next guest is Hershel Clark. Hershel is a graduate with a master's in public health from the University of Arizona, and he works with the Southwest Navajo Tobacco Education Prevention Project. Hershel, please share with us about engaging with tribal leaders and coalitions.
All right, thank you, Joshua. First of all, I'd just like to thank everybody for participating and really just engaging with this initiative with our people throughout Indian country. I think this is a really strong public health movement for not only just our tribal communities, but our nation and worldwide when we talk about secondhand smoke exposure. So thank you, appreciate it. So today, I'd just like to just share, some of the things that we've done with our Southwest Navajo Tobacco Education Prevention Project. We're located here in Winslow, and our service areas is really just with the Navajo Nation. So when we begin to think about, who we want to engage with our message, you want to identify partners that your program or organization works closely with. For example, with our office, we work closely with our traditional healers and grassroots organizations on the Navajo Nation, and really just engaging with them, just identifying, I guess, first of all, just identifying your program, who are your partners? Who are your partners that you could reach out in regards to this initiative, sharing this information with them. And I think it's really key to get their perspective and their views on secondhand smoke exposure within our tribal casinos. And I always advocate for cultural perspectives, because when it comes to tobacco control in Indian country, we all know that we have a very unique relationship to the plants, to the herbs, and then just the stories and in the cultural context that we have. It's a little different from prevention and education activities or ways of doing it from a non-native perspective. So that's kind of like how our program is really engaging with the community on that level, the people's perspective, or native people. And just continuing on, also just looking at grassroots in your own communities, identifying organizations, just a few of them that I would recommend throughout Indian country. We all know there's a significant amount of powwow organizations. These consisted of dancers, singers, and I think just through our experience, there is a lot of these dancers and singers would support this initiative because they're all about health. They're all about giving back to the community, praying for them, and just really giving that natural balance to our people. And I think this would be something that they could move with as well. So just reaching out to some of their power organizations, and also Indian Rodeo Association. I know a lot of our Native American tribes and individuals are becoming professionals in this area. And I think Indian Rodeo Association is a good partnership, individuals who are professionals that could really support in helping with this initiative. So just identifying who is, who are these individuals within these professional realms, and also sports too as well. I think that's something that we really gravitate around Indian country, especially basketball. And I would really recommend identifying individuals that you could probably reach out to in your own communities to really help with this initiative. And then we also have our religious groups. We have the Native American Church of North America. They comprise, from our experience, they have over 200 organizations throughout Indian country. And these organizations would really bring that cultural perspective and really have a large following too as well. So just really reaching out and identifying the key individuals when these organizations. And also just not only just talking about organizations, there's also key individuals in the community, such as spiritual leaders, local leaders, that really could engage with this initiative and just sharing just resources and kind of getting a good dialogue with them and how they could really share this information back into the community. So just really using that community-based participatory approach when it comes to engaging our leaders on a local level too as well. And then also identifying not only community or grassroots perspectives, but it's also critical to understand our own tribal health programs. What type of tobacco programs do we have? Or if we even do have any. I know some tribes do not have any tobacco programs, but I think it's also just exploring other programs underneath the tribal governments that will be interested in this initiative. There's such thing as tobacco programs with behavioral health education programs, and then just reaching out to really trying to identify the managers, the staff, the people who are within these programs that you could reach out to. So just really identifying your tribal health programs is really important as well. And then there's also the Indian Health Services, the 638s, the Indian Health Boards, these individuals. And a lot of the information is really just on web too as well. And that's some of the things that we've done. And I'll share how we reached out to them. But I'm just going to go down the list of how, people identifying partners that could really help move forward with this. And then, for example, we've reached out to the Navajo Nation Department of Health with all their managers and supervisors. We send, numerous emails out to them. Just, even though I know a lot of our health departments right now are currently addressing the COVID-19, but I think it's really just important just to share this information with them, just to kind of link them in regards. Maybe one of their staff members will be able to pick it up, but just continue just to engage with them at that level too as well. And then also some of the experience that we had, we reached out to the universities. As a former student from the University of Arizona and Arizona State University, I was able to kind of reconnect with some of my colleagues and professors or individuals at the university and kind of share what we were doing. And they have a whole different network among universities as well that could reach out to the students that'll be interested. So I would really encourage some of our people to really just reach out to these universities and share this initiative with them, and maybe they could share among their network as well. And also your state health departments. One of the things that we've done is we reached out to some of our partners at the state level and really trying to just gain their support as well. And I really think this is a unique opportunity not only for the tribes to reach out to the states, but it's also really a unique relationship that we could build with the state health departments to support this effort. And I only say this because, you know, public health in regards when we talk about ways to address secondhand smoke, and we all think about this, and we kind of, you know, you kind of think about where the environment of secondhand smoke is actually at, you know, these days. And primarily where we see it is in tribal casinos, our state casinos, our private casinos. So when we talk about secondhand smoke on a not just on a tribal, state, or, you know, federal level, globally, you know, it's really in these casinos. So just getting their support in regards to what we're doing, as well as reaching out to them and identifying key individuals within the state departments is also important as well. And also just, you know, some of the departments that we reached out to through our experiences, you know, the tobacco programs, the chronic disease programs, Ashline is a really good network as well. Health education, and then youth coalitions. So one of the things that we've done with here on the Navajo Nation is we reached out to our state partners. We're part of this Students Taking a New Direction Youth Coalition. It's an anti-youth coalition on tobacco. So we reached out to all 36 of our partners, just sending them information of how they could, you know, just help in our initiative, just sharing our links, sharing our flyers, and if they would like to participate, just engaging with them a little more. So I really would really encourage you to include the youth to be involved in this initiative too as well. And I think we all have, you know, some areas that we could, we all have our connections to the youth in some different ways. And also the nonprofit organizations that could also assist in this effort, such as American Lung Cancer, or American Lung Association, CDC, NIH, NARCH, Campaign for Tobacco Kids, Intertribal Council Association for each state, National Congress for American Indian Council, and of course, American Non-Smoker Rights and National Native Network. I think there's a huge amount of organizations that we could reach out to in different regional areas and also nationally too as well. So I would encourage just to really identifying partners that you could really share this information with. But I like to go into identifying effective strategies to reach our communities. As we all know right now, the best effective strategy to share information is really just through social media. And I think that's been one of our key success stories through our initiative here on the Navajo Nation. Just to share a little bit, we actually had a radio forum. I don't know if Josh, if you could go to the next slide. Oh, one more back to the slide. Okay, so this slide right here shows our radio forum that we had a couple on May 6th, which is a couple, I think, weeks ago, and we really marketed this just through social media, and also just if you could see our Eras Life Youth Coalition group, our web is right there on the right side. And it's really interesting how social media, and we all know how effective it is in just relating to messages. And I think roughly before we started this initiative, we had roughly only just 400 friends that we had on our Facebook post, our page. And then after the KTNN radio forum, our friend requests just went up, like just increased significantly, where I can't even manage the number of friends requests that we're getting now. I think we're almost close to 2,000 friends, and that's only just within a week span since we had our radio forum. So I think the most effective way, of course, is just through social media. And if you guys, some organizations don't have a social media right now for this initiative, I think it would be really interesting to just start up a Facebook post, a Facebook page, and just share this initiative, and we would be willing to share our resources and information as well. So social media is one of the most effective ways, and also emails. I think since our radio forum and then also this webinar, I sent probably over 500 emails to our partners, people who I was able to identify through the internet, looking at just Googling some of these organizations, finding their contacts, their emails, and just sharing this webinar information. So I think emails is one of the most effective ways as well. And also just when you just share this information, it's also sharing resources, educational materials, which includes the flyers. And then one of the things that I was able to do is develop a template letter for some organizations, such as our student youth coalitions, that were wanting to kind of understand, like, how can we reach out to our tribal gaming or tribal leaders. So we developed a template letter that we could send to tribal leaders, really just explaining what this effort is for them to reopen, and also sharing what secondhand smoke is, what is the dangers of it, just a small little, just a brief paragraph on that as well. And, we'll be able to send these out to our tribal gaming, our CEOs, and the board members as well. So that's another effective way, is just sending letters through emails as well. So I guess I'll go ahead and go down to it, disseminating information on why 100% smoke-free is important. I'm sorry, I think I lost. Joshua, can you go to the next slide, please? So when it comes to engaging with our tribal leaders, I think the first thing is just identifying who our tribal leaders are, from our council members, to our president, to our vice presidents, to first lady, to second lady, and really just trying to get a scope of who our leaders are on these tribal communities. And I think for Arizona, there's about 22 tribes in the state of Arizona, and they all have their own different government structure with their council, their president, their vice president. So I think the most effective way is just looking at their website. I think that's one thing that we did, is looking at the website, looking for their contacts. All their contact information is there. And when you send out information to these individuals, it's best to also include their staff members. That's one thing that I did, that I saw. I know their leaders are probably all busy, but I think if you include their staff members in their emails, in some way, hopefully they will get the message. So that's another effective way. And also contacting our tribal gaming leaderships. Right now we're in a mix of just reaching out to our tribal gaming board members, and then also the CEOs and managers, identifying who is the managers, how do we contact them. I think through webinar or through the web, their gaming websites is good information on that as well. And also National Indian Gaming Association leaders, the website, they also have a lot of their email contacts and all their information that we could reach out to them as well, and just sharing this information with them. And then also the regional organizations from underneath National Indian Gaming Association. I understand they have their own regional entities underneath the overall Indian Gaming Association. So really just contacting them as well. And also just, I could go on and on and on, but I think one of the things that we've done as well is that we're going to be exploring is contacting your state representatives and congressional leaders as well, and just sharing this information with them. And I think the most thing that we say on our side is just really just encouraging and giving them information and the resources. It's not really advocating for any policy or anything like that. It's really just encouraging them to reopen, giving them the education, giving them the resource, and informing them of the importance of this public health initiative. So those are some of the, I guess, leaders or organizations that you could identify within your own tribal community or your state. And the most effective way, like I said, is just email, social media, newspaper outlets, and also just their websites, Facebook, and then also, I like to share also one of the things that we did is we also did a polling with our people, really wanting to know, just one simple question that we asked them was, do you support our Navajo casinos reopening as smoke-free after the COVID-19? Just a simple question that we had, and we sent it out through social media, and there was a really good response. I think our numbers showed that 85% of our people did support that the reopening of our casinos to be 100% smoke-free. So that's out of, I think we're at almost 250 people who took part in that survey as well. So polling data information is really good information to share with your tribal leaders as well. I guess just in conclusion, there are a lot of resources and organizations that we could connect with and share this with, and we just need to identify these potential partners on all, all the way down from the community level to your tribal governments to the state and federal levels. All these organizations and individuals are very important, and most important is just to continue to educate our people in general on the importance of this public health information. So, but thank you. I look forward to anybody who would like to connect with us, and we'll definitely share some resources with you guys as well. Thank you, Joshua.
Thank you, Hershel. Engaging with tribal communities and leaders is really vital, and I'm really glad to hear the response that you've been receiving from the Navajo people. Now we will transition back to Clinton and let Clinton discuss some projects that he's been working on. And then we will video afterward.
Thank you, Hershel and Missy. Thank you so much for all the information. I wanted to mention that we have been working on these mini videos to share with tribal leaders and tribal citizens about the benefits of reopening smoke-free. They've been getting a lot of attention on social media, so social media definitely works. I was actually did an interview with Indian Country Today yesterday about these videos, and so I asked Patty, who is the anchor, she's Hopi, where she found this information or watched the videos, because I'm not friends with her on Facebook, and she said somebody sent it to her. So these are definitely getting around. This information is getting around, and I think tribal leaders are already, I mean, even without this information, I think they're already considering the idea. And so I think us sharing more information kind of solidifies it and pushes that idea that, yes, this is something that is possible and something that we can do. And I just want to announce real quick, I was looking on the news thing, and I'm keeping track of tribal casinos that are going smoke-free. And I'm from Wisconsin. It's very, it hits home to me to hear of any tribal casinos going smoke-free in Wisconsin. But Oneida Nation of Wisconsin just announced that their casinos are going to reopen smoke-free. They have two, one in Green Bay and then one outside of Green Bay in Oneida Nation. And so it's very exciting. There's 3 casinos in Washington, tribal casinos, that are reopening smoke-free, and 2 casinos in California that are tribal casinos reopening smoke-free. So this work is definitely the idea is definitely out there, and I think we just need to give it a final push so that there could be more of a domino effect, and these tribal leaders and elected leaders and gaming officials can really see that this is what the people want. The time is now, and I want to go into sharing the one of the videos, and then we're going to leave it up for a discussion. And we have Josh shared that there's a question box in your control panel for your webinar. Feel free to start putting questions in there and asking your questions while this 2-minute video is going. And once this video has ended, we'll open it up for discussion. We'll answer some questions, and we'll go from there. Thank you.
Thank you, Clinton. Now we will watch this video.
Dear Tribal Gaming Leaders, Dear Tribal Gaming Leaders, our world will never be the same post-COVID-19. The public expects clean air and healthy spaces. They will seek experiences that do not jeopardize their health. Tribal casinos can meet public expectations with one simple change. Reopen 100% smoke-free. Consider the cost savings of going smoke-free. The casino spends less money on air filters, 0 hours spent removing tar and nicotine residue from machines and cleaning ashtrays, fewer employee sick days from secondhand smoke illnesses, and a drop in health insurance costs from fewer employee doctor visits. It is proven that smoke-free tribal casinos earn more revenue. Patrons play machines longer at smoke-free casinos, and smoke-free casinos attract diverse clientele with higher disposable incomes. Maximize the investment made to deep clean, disinfect, and sanitize the casino when the casinos closed due to COVID-19. Maximize your revenue and embrace a healthier world. Now is the time to go smoke-free.
Please reopen casino smoke-free. Please reopen casino smoke-free.
So this is one video of a few, right, Clinton?
Yes, our second video that we just released a couple days ago is on health benefits of tribal casinos going smoke-free. I was presuming that a lot of the attendees on this webinar would have understanding around secondhand smoke and the health risks imposed to those exposed to secondhand smoke. So I think people have a general knowledge of it, but we wanted to share this financial benefits of going smoke-free because I think this is the real message that we want to get out there too, is that we want to be supporting these tribal casinos, and we want them, as soon as they reopen, we want people to go into these casinos and to play and to have a good time and not worry about their health. And I truly believe that happens by providing a healthy, clean environment that is smoke-free, and I think a lot of casinos know that too, and so they're starting to reopen smoke-free, and so yeah, so that's what the second video is about. We can open it up for a discussion with any of the attendees that are on. If you have any questions for Missy Tracy, who's the casino man, who works at the Ho-Chunk Gaming Madison Casino, for Hershel Clark, for myself.
So we actually do have some questions. I did just want to ask a couple quick questions, and I will also read some of the questions that have come in. So how do you engage with tribal gaming if they previously had no interest in making their facilities smoke-free? How would you approach them? And that's not just for Clinton, that's for any one of our panelists who feel like chiming in.
I could go.
Yeah, go ahead.
Go ahead, Hershel.
Oh, no. Okay. I guess I think just from our experience, one of the things that we approach is, just being very, very, very respectful to our tribal leaders in the gaming industry. And I think one of the effective ways we did is really just sharing data from the people's perspective, that this is what the people want. It's not us, I hate to say it's kind of like they think we're nagging them or, pushing them or forcing them, but it's really just relating that information from what the people are saying, using that data in the most effective way, and sharing and just being respectful. If some of the leaders don't want to hear us, it's okay. Just kind of brush that off and just be like, okay, we'll go to the next leader, because they're all not going to support this, of course, but it's just kind of brushing the scope of your leaders and identifying which ones would be supportive, and then really just engaging and continuing that engagement with that individual or that tribal leader. That's what we found throughout the years. I think our organization's been advocating for the last 15 years for smoke-free casinos. And then throughout the time, the leadership has changed numerous times, and we kind of just continue just to engage with leaders that would support us, and hopefully they could share that information with their colleagues as well. So it gets very political, but I think it's just relating to the information from the people's perspective has been effective for us.
I want to point out, I think another really effective way is the comment cards at the tribal casinos, or if there are any types of reviews that the tribal casino has online. The managers really pay attention to those. I think Missy kind of alluded to that in her conversation, that they were starting to get comments on it, and then they went forth and did a survey. So I think a really good idea is to look on your tribal casino's website. They might have like a leave a review or leave us feedback option, and you could post your feedback or write them a message in there.
Maybe I can just say a few words real quick. Another thing is that we need to educate our people, all the indigenous tribes. For example, Navajo. We've been saying that in order, that the casinos, they're tribal businesses, they're tribal enterprises, and they get the leeway to do those without tax. So in their charter, every one of the Navajo tribal enterprises, it starts out by saying that this business belongs to the people. So we need to educate our people, saying that that's yours, that's ours, every one of it, that's ours. We need to have a say. Okay, thank you.
Thank you, everyone. I wanted to put a plug out. There is a Facebook page called Native Tobacco Leaders. Please go like it on Facebook and feel free to share successes there. There's a note that Standing Rock Youth Council started the community surveys for smoke-free casinos. There's a question, and this is for all the panelists. What are social media platforms that you're using? Instagram, Twitter? They're asking if you have a number. They're trying to find where they can follow all of you. So the National Native Network, we use Facebook, Twitter, Instagram, and LinkedIn. And so you could search Keep It Sacred on all of those platforms and you'll be able to find us. But on Instagram, our handle is NNN, at NNN Keep It Sacred. But Clinton, Dr. Henderson, Hershel.
I use Facebook for communication right now. I wanted to let the attendees know I don't know if it's possible, Josh, I know we have everyone's email. We're going to send a resource list with these videos and I guess other pertinent information to kind of help with some talking points or resources that you could pass off to your tribal leaders when you have these conversations with them, or when you write them in an email and you want to send them information to kind of help support what you are proposing, or the conversation that you're having. So we'll definitely send that out if it's resources that everybody's looking for.
There's interest from people about being sent information about reopening casinos, because they're mentioning that their casinos are set to reopen on June 1st. There's a question, I'm not sure who this was directed to. I'm guessing it was to Clinton, but it asks if you'd like a connection to the Saginaw Chippewa in Michigan. There is a comment from Tara Huska saying, awesome to hear that Oneida Nation is opening up smoke-free. We're glad that you were able to join, Tara. Someone else mentioned that it's great news about Oneida Casino. And then they were asking if there's a news release about that they can share.
Yeah, I just put it on my Facebook page, the news link. But when we send this resource page out, we will definitely have that included in there. But I guess it's shared on NBC26.com, Green Bay. So go on NBC26 Green Bay, Google that. They should have a website, and then you could look for wherever it says Oneida Casino to reopen phases starting May 26. That's the headline.
Thank you, Clinton. Someone noted that the Siletz Casino in Oregon also opened smoke-free, so that's another win. Here's a question that's for all the panelists. What barriers have you faced when trying to get casinos to go smoke-free? I know we've kind of addressed it, but here's another opportunity to share some more information.
I could go first. I think for for the Navajo Nation side, I think it's just our leaders really looking at it from a financial point of view, and then also having data, because they have their own data from every time we do engage or talk with them. They do say that they have their own data, and the data shows that if they do go smoke free, they're gonna really lose a lot of their patrons or visitors. So we really need our own data. And I really like what Clinton mentioned and some of the other initiatives that really just looking at it, the gaming VIPs, doing our own in-house surveys with our members of these gaming industries. I think that's something that would be really valuable, and it's been a challenge really trying to get asking those questions within our tribal casinos with our leaders. I think that's something somewhat of a barrier. And
Yeah, I'll add that it's difficult to talk with gaming managers, especially with them being so busy, and it's somewhat of a challenge. Uh-oh, I think someone's not on mute. But I want to add, with all of these new tribal gaming casinos that are reopening smoke-free, it's really pivotal that we, as supporters of this, congratulate them and really recognize what they just did. It is so important, and it is so beneficial to people's health. So if you guys know of a tribal casino that reopened smoke-free, write them on Facebook, write the gaming manager, and tell other people. And we really have to try to support these tribal casinos as much as possible at this time, and especially as they're reopening smoke-free.
Thank you, Hershel. Here's another question asking about if there's any support from tribal gaming associations, or has anyone approached NIGA, which is the National Indian Gaming Association, or their regional Indian gaming associations to get them involved?
From my understanding, if we wanted a tribal casino to go smoke-free, you have to reach out to the gaming manager. I've been through that road of reaching out to NIGA and reaching out to different boards and things like that, but I'm always redirected to talk with the tribal gaming managers specifically. I think it is it's those managers that are risking kind of or not, I don't want to say risking, but they're the ones making the decision, and they're the ones that will be kind of they're the main decision maker of this. And so I'm not sure. I mean, NIGA would be a great opportunity for them to share this message and share these resources with other tribal casinos. And if anybody is on the attendees, if you're on NIGA or know people on NIGA, please send them these resources so that they can share them with their colleagues.
Thank you. Here's a question directly for Missy. Great work and a great model to look at. Did you find any opposition trying to counter the work of going smoke-free, such as the tobacco industry?
I'm sorry, what was the first part of the question?
So the first part was just kind of a congratulations on the great work and a great model to look at. And then the question asked, did you find any opposition trying to counter the work of going smoke-free, such as like from the tobacco industry?
No, because in our messaging, we were very clear that, well, first off, let me back up a little bit. In July of 2010, there was a smoke-free initiative enacted in Wisconsin, and we remained a smoking facility until 5 years later. And when we came out with our messaging, what we said was that we are exercising our sovereignty, and that we made the choice to go smoke-free of our own volition, not being mandated by anyone. So it was a true exercise of our sovereignty and an opportunity to educate folks. So I think that coming out with that, it kind of shot down anyone trying to oppose that, any, you know, vendors or anyone else. In fact, what we experienced was just a lot of support from our community, tribal and otherwise. And I just want to comment that, yes, the comment cards are looked at very closely, and we received nothing but positive remarks. I mean, there may have been, you know, a couple here and there in opposition, but again, financially, we just didn't see the impact. We didn't realize any negative impact from that once we got past that 90 days.
Thank you, Missy. So that was our last question. We have a few more here in the queue that I will share with the panelists, and we will include it on the webpage when we post the archive. So thank you all for those great questions. And now I'd like to introduce Dr. Patricia Henderson to give some closing remarks.
Good afternoon, my relatives, all that are listening this afternoon. I really appreciate you taking the time to kind of listen to everybody on this panel today. It's just been wonderful working with them, organizing this event. From the very beginning, Clinton just was so gung-ho about this. His enthusiasm for this initiative, right, this time and moment is so contagious that as soon as we met with him, got off the call, we were like, okay, what do we do? I mean, Clinton's so excited about this. We got to do something on Navajo Nation. So we started working very closely, like as Hershel described, with our partners, with our communities. The support is there on Navajo Nation. More than 85% of our Navajo people want a smoke-free casino. As we've heard both from Missy and from Clinton, that this benefits the casino. Financially, it benefits them. But I think for me as a scientist, as a physician, I've been doing this work in public health, in this area of public health for more than, 20 years now. And you know, we're at a really crossroads right now with our communities. We have so many people suffering from COVID right now in our own tribal lands. And it's just really, really unfortunate this is happening. And I think about that and kind of framing, I guess, our next steps, that our health is so, so fragile. As we know, you know, you can be the healthiest runner out there, you know, and like I was, and get hit with COVID, you know, and it just nails you, you know, your respiratory, you know, just fails in many cases. And so it's just so important that we take our health very, very seriously. And that's the reason for this webinar today, is just kind of reframing it for ourselves, that our health is sacred, our air is sacred. And then all of us on this call just have, if you can just make that one call, you know, one email, one post on your Facebook, wherever it is, just urging our tribal leaders, our casino leadership to open up smoke-free. You know, I'm sure if we do this all collectively together, that we can really make a change. I just did this morning on Navajo Nation's gaming site. You know, it's they have this little area where you can provide comments. I just call them, I love going to your casino. However, I have asthma, and I can only stay in your facility for a short period of time. But if you were to open smoke-free, I would definitely stay longer, and I would go more frequently. So it's just that easy, and I encourage all of you to do that. Please take care of yourselves during this time. Take care of our elders, your elders, our children, and all together we're going to get through this very trying time for our people. And I just want to end in that we're all praying for each other, praying for you, and for all my Navajo relatives that are out there. Thank you.
Thank you for those closing words, Dr. Henderson. Thank you all for dialing into our webinar today. There will be a archived version populated on our website here in the next couple of hours, and you will receive a follow-up email from your attendants today with that link embedded in it. Thank you all. Have a good rest of your day and a good weekend, and go in health and good peace.